Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Functional components of the cranial nose. So here first let's look at some abbreviations you're going to use. So A we are going to use is going to the afferent, E is for the efferent, then the BR, it stands for the brachial. So BR is a brachial, that is a word special derived from the branches, and it can be used instead of the branchial. And but it can also be the special sensory, that it carries a special senses. Next is V. The V is it is the visceral, and G comes for the general, and CN stands for the cranial nerve. Next is SO, stands for the superior oblique. Now let's look at the functional components of the cranial nerves. So starting with the oculomotor nerve. So what is the oculomotor nerve? The oculomotor nerve is nothing but the cranial nerve 3, and there is a extraocular skeletal muscles. So it is a extraocular skeletal muscles. So this is nothing but it is the GSE. Then comes the preganglionic fibers of the ciliary ganglia. So this is nothing but again the GVE. Next we look at the trochlea. Trochlea stands for the cranial nerve 4. It is extraocular skeletal muscles. Then is the trigeminal. Trigeminal is nothing but the sensation, and this is from the face. That is, it is the GSA and the motor to the first arch. Then comes the BRE and the SVE. Then comes the abducent. Abducent is the extraocular muscles. Extraocular, it is the EO skeletal muscles, and this is from the lateral rectus, and that is the GSE. Then comes the facial. Facial is nothing but the cranial nerve 7. This is the general sensory from the ear. It is nothing but the GSA. Next is the special. The special is nothing but for the taste sensation. This is the BRA. And then comes the motor for the second branch. This is the BRE. Then the parasympathetic to the submandibular. Then comes the parasympathetic to the submandibular and the pterygopalatine ganglia. That is the GVE. Next is the vestibulocochlear. So vestibulocochlear is concerned with the cranial nerve 8. It is cranial nerve 8. It is for the hearing and the balance. So this is nothing but the SSA. Next is the glossopharyngeal. Glossopharyngeal is for the sensory from the pharynx. The pharynx and also the tongue. This is the GVA. Then comes the taste. That is the BRA. Then the general sensation from the ear. This is for the GSA. Then comes the parasympathetic to the otic ganglia. This will be the GVE. Then the motor to the third arch. This is nothing but the BRE. Now let's look at the vagus. The vagus is nothing but the CN10. That is cranial nerve 10. It is sensory from the ear, and that is the GSA. Sensory from the pharynx and the larynx. That is the GVA. Now how about the taste? The taste is nothing but the BRA. The parasympathetic ganglia in the thorax as well as abdomen is nothing but the GVE. Then comes the motor to the 4th and 6th arch, that is again the BRE. Now accessory. Accessory is nothing but the cranial nerve 11. It is the motor to the 6th arch, and this is the vagus, and then it has the BRE. This is next is the motor to the SCM, that is sternocleidomastoid, and also the trapezius. Next is the hypoglossal. Hypoglossal is the motor to the lingual muscles, and also it the GSE. To learn and grow daily like this, please do subscribe.